Knee replacement surgery can be an extremely successful operation, but unfortunately, some patients don't have a great result. And today's video, I'm going to talk to you about 5 mistakes that you need to avoid to get the best result after surgery. Hello and welcome back. I'm Adam Rosen and thanks for watching this channel. If you could please take a moment and click the thumbs up like button so people like you find content like this. Now, knee replacement can be an extremely successful operation. It can improve patients' lives. It can get you back to doing the things that you want to do. But unfortunately, some patients don't have a great result. And some patients are unhappy that they even went through the surgery in the first place. Sometimes that's due to mistakes that are made along the road to recovery. So in today's video, I'm going to talk to you about 5 mistakes that some patients make so you're aware of them and you can avoid them to get yourself the best total knee replacement possible. Mistake number 1 is blind faith. This is basically going through surgery because someone told you you should have a knee replacement, or even the surgeon said you need a knee replacement, and you didn't know what you were getting yourself into. You didn't realize how big of a deal the surgery was or how long or difficult the recovery would be. Sometimes patients go into surgery blindly because they just think that they're going to get better, but they weren't really bad enough to begin with. They didn't have severe arthritis. They didn't have limitations in their activity. They didn't fail conservative care treatments. And these are things that you should do before you rush into a big operation. And the other part of this is not being optimized. So complications can and do occur. And if you have things like uncontrolled diabetes, or you're a smoker, or you're overweight, and those things are modifiable risk factors that can be addressed and optimized prior to surgery, they can actually decrease the chance of you having a complication like a blood clot or an infection after surgery. Mistake number 2 is overdoing it. And this is a little bit complicated because you can very easily do too little. If you lay on the sofa or the recliner, oh, woe is me, and think that you need to lay there and recover because people should be waiting on you hand and foot, you're not sick, you're not ill. This is an arthritic sports injury. You got to get up and walk it off. But on the other hand, you can do too much. If you push too hard, your body can react negatively, which can result in more pain and more swelling, which can impede your progress. Now, one of the patients that I took care of many years ago was a physical therapist, and he described it quite well, is that when we're young and healthy, we can train. And in training mode, we can push even beyond sort of a certain point, but because our body was healthy to begin with, it can recover. When we have a traumatic injury or when we have surgery, your body is in recovery mode. So there's a lot less wiggle room. It is much easier to push too hard. So working along with your therapist and your surgeon, you can make sure that you're making progress day by day and week by week, but being sure to not push too hard and too fast. And for some people, it's 2 steps up, 1 step back, 2 steps up, 1 step back, and you don't always know how much is too much for you until you start to see the pain and motion, which was improving, now all of a sudden start to go backwards. That is a warning sign that you're doing too much and you're overdoing it. Mistake number 3 is neglecting physical therapy. And this sort of piggybacks off of mistake number 2. The thing that I stress to all of my patients is when you have knee replacement surgery, when you wake up from anesthesia, you get 1 chance. That's it. The best chance of getting full range of motion after total knee replacement surgery is between week 0 and 6. You have a pretty good chance of getting more range of motion between week 6 and 12. But after 12 weeks, it is near impossible to get more range of motion. So range of motion, goal number 1. Goal number 2 is strengthening. You need some amount of strength to be able to walk and get off of the walker and the cane, and to go up and down the stairs, get on and off of the toilet. So goal number 2 with physical therapy is strengthening, but it should never become more important early on when compared to range of motion. The very last part or component of physical therapy is endurance. Your ability to walk far can come at 6 months, at a year. You can build up your endurance over time. But again, therapy is so important because there are no second chances. If you do not do therapy and at 12 weeks are stiff and painful, your surgeon and therapist most likely will say, "We are sorry, it is too late. Your knee is stiff and there's not much that we can do about it." So work hard from the beginning, listen to your physical therapist, and do the exercises that were prescribed for you. Mistake number 4 is ignoring pain and swelling. Now, understand you had a knee replacement. You're going to have pain and you're going to have swelling, but we want to keep them at a manageable level. Now, as part of your multimodal pain regimen, your pain should be under control. You should be able to get some sleep at night. You should be able to get up and walk. You should be able to do and complete your physical therapy. And if you can't do those things, you need to talk to your surgical team and figure out what things can be added to your pain regimen to get pain and symptoms under control. But you need to make sure that the pain is controlled enough to do the physical therapy, realizing that your pain level is never going to be 0 or 1. This hurts until you get through the rehab component and making sure that your knee at that point is working well. The second part of this is swelling. Again, you will have swelling. Swelling is normal, but swelling overall should be decreasing day by day, week by week. You should see an improvement in swelling. Now, there's a number of things that you can do to control swelling, like compression and elevation and icing. You may have seen one of my other videos about a supplement that you can use that can also help reduce swelling. But we want to make sure that the swelling stays at a manageable level, because if you have increased swelling, that can actually increase the risk of you developing a blood clot. And if you have increased swelling, that can actually impede your ability to work on range of motion with physical therapy, which could actually lead to scar tissue down the road. So listen to your body and listen to your pain and swelling, and make sure that going forward, day by day, week by week, overall, your pain and swelling is improving. Mistake number 5 is skipping follow-up appointments. It's extremely important to have regular follow-up appointments, both early on and late. You might have seen one of my other videos about late follow-up, and that's so we can keep an eye on the implant years down the road to make sure that things aren't wearing out. But in the early postoperative period, it's important to keep your regular appointment. Now, if your pain is significantly out of control and therapy thinks something's wrong, call your doctor, make an appointment. They might check an x-ray to make sure the implant looks okay, that the bone is still okay. They might examine your knee to make sure that your tendons and ligaments are okay. Those are all things that can happen. They're rare, but it could lead to problems and could be one of the reasons why you're not progressing with physical therapy. The other thing is that if your knee is red, and especially if it's draining, you need to see your doctor and see whether or not you have a collection of blood in the knee called a hematoma, or whether or not you could be developing an infection. The quicker that treatment is started, the better the chance for successfully getting rid of blood that's inside your knee or successfully treating an infection. And the other important thing is range of motion or lack thereof. You need to see your doctor for regular appointments, because if you're failing to progress with physical therapy, your doctor might recommend something called an MUA, or manipulation under anesthesia. This is an attempt early to take you back to the operating room, to bend your knee under anesthesia, to break up scar tissue, and to prevent more scar tissue from forming, in the hopes that we can help you regain full range of motion after your surgery. Well, there you have 5 mistakes that you need to be aware of and avoid after surgery to have a successful total knee replacement surgery. So remember, if you're having a knee replacement surgery, you probably should be having pain or other symptoms. You should have failed conservative care, and you should understand what you're getting yourself into. Based on your medical conditions, you want to make sure that you're as optimized as possible to lessen the risk of a complication occurring. The other important thing is physical therapy. We want to make sure that your pain is controlled and your swelling is controlled. You want to make sure that you do not do too little of physical therapy, as well as not doing too much of physical therapy. So you stay in that middle range, which should allow you to improve both your range of motion and your ability to mobilize and exercise, so you can head towards that end goal of having a successful outcome. And be in contact with your surgeon and your care team. If things are not going well, you want to let them know what's happening and what you're trying to do to fix it so that they can then get involved and give you advice on what things might be changed or modified so you don't get into trouble. And again, the main goal is to make sure that you have a highly successful knee replacement surgery and recovery so that you're happy with the end result. Until next time, thanks for watching. I'm Adam Rosen. Stay safe.